Hey everyone, welcome back. I am Dr. Z, a licensed psychologist who specializes in working with transgender adults for the past 20 years. And today I want to talk about something that comes up constantly in my practice, and that's the tension between early intervention and rushed decisions. And I want to offer you today tips and guidelines on how to find your own balance, how to make sure you're not making any rash decision, how to make sure that you are thinking clearly about what you're deciding to do. I'm going to give you lots of tips. I'm going to cover a lot of ground today. So if you are early in transition, if you are mid transition, if you are thinking about gender transition and not even sure where to begin, this is a great video for you. This topic is especially loaded right now. I mean, it's always been loaded, but even more so right now. On one side, we hear trans people need immediate access to care, and the delay causes a lot of harm. And on the other side, there's slow down. Make sure you're really trans. Don't make irreversible mistakes type of argument going on. For that reason, the polarities causes a lot of tension. Both of the sides contain some element of truth for sure. And both can be clearly and are being weaponized against trans community. So today I want to offer a very nuanced, clinically informed perspective that honors the urgency many trans adults feel while also acknowledging that thoughtful decision making matters and how to help you create a balance in your own personal lives. And if you are a mental health provider, I know there's some that's watching my content. Welcome on here. This is also a space for you. And hopefully you also have a takeaway from this in working with your gender diverse clients. So let's begin by discussing why early intervention matters for trans adults. I'm going to start by being very clear and saying that early interventions in gender affirming care absolutely save lives. The research on this is overwhelming, and I see it in my practice every single day, and I have been seeing it for the past 20 years. The evidence clearly shows when trans people have access to timely gender affirming care, mental health outcomes improve dramatically, suicide risk decreases significantly, quality of life increases across the board, social and occupational functioning improves, and an overall well-being is substantially better for trans adults. Here's what I also know from both research and my clinical experience of 20 years working with trans adults. Forcing trans people to wait for arbitrary periods, jumping through unnecessary hoops, or to prove their trans identity causes measurable psychological harm. As a psychologist, I see this harm all of the time when people are forced, especially to jump from some ridiculous hoops. A lot of you are familiar with, especially the ridiculous hoops for trans women, such as you need to go out there and socially live your life, presenting as a woman before starting hormones, before feeling confident, before starting to have physical changes. You need to go out there and present, which puts a lot of women at risk, and it's just a ridiculous hoop to jump from. So when I work with clients who were forced to wait years for care they knew they needed, this is what I often see. I see increase for sure. Depression and anxiety tends to increase. I see lost years of living authentically, and therefore the internalized regret goes up too. I see deepened dysphoria, which then makes it difficult to eradicate. I see trauma from being denied autonomy over their own bodies and decision making. And I see a lot of grief over changes that could have been prevented with access to care. Now, from my clinical experience, early intervention, specifically, especially hormones, and especially for trans women adults, and the reason why, especially for trans women adults, is because feminizing hormones for even a period of a month are not going to produce any big irreversible changes. In my experience, hormones, particularly essential for trans adults who have moderate to severe gender dysphoria that is causing a lot of psychological pain. For many, such emotional pain leads to harmful thoughts, very severe isolation, or utilizing unhealthy coping that does more harm than good. And all of you watching this who have severe to moderate psychological distress know this. When I see trans adults in such psychological pain, in the very least, a low dose of hormones is important. Here's why. Even a very low dose can bring down psychological distress to the point where a person can then think about making a much more clear decision without a need for strong urgency. And when all of the distress goes down, you can clearly have more clarity, at least, to decide what steps to take next. Because remember, and you know this from me on my channel, I talk about it all of the time. In my opinion, transition is not mandatory, nor is it for everyone. I work with many adult clients who remain on hormones alone throughout their entire life without stepping into social transition or even surgical transition. I also work with a lot of adults who cycle through hormones to manage their dysphoria. For many, gender affirming surgery is a necessity for sure to manage physical aspects of gender dysphoria. But for a lot of people, sometimes they realize transition to that extent is maybe just not worth it, or, and this is an important one, is not something they have accessibility for, whether it is financial or whether it is due to safety reasons where they reside. So really, really important to keep that in mind. So yes, early intervention definitely matters. Starting and jumping into early intervention matters for a lot of people, but not also for all. Now, here's where it gets really complicated, because I also see people in my practice who moved very quickly and then had questions or concerns about certain decisions. Not their trans identity. I want to be very clear. Not their trans identity. Usually, they're still trans or gender nonconforming, but they had regrets about specific medical interventions and whether they actually needed them or not. For example, jumping into getting breast augmentation, only to then realize that you actually maybe would prefer a smaller size of breast as you evolved into your womanhood, or that hormones alone gave you just the right size that you actually wanted and needed. So I want to be very careful here because, as we all know, a lot of people tend to weaponize the transition stories and regret narratives. And I'm very clear on the fact that yes, there are absolutely individuals who do also regret because that was never their gender identity. Those stories are incredibly important to listen to. In my experience, however, working with transgender adults, especially older adults, I don't see the regret tied to, oh, I'm not really transgender. I see sometimes minor regrets too. I could have waited. I maybe rushed. Maybe I didn't vet my doctor enough. I didn't do my research enough. Those types of regrets versus I'm not trans. So I just want to be very, very clear because most people, in my experience, who did transition do so because of external pressure, discrimination, or lack of support or lack of resources, not because they weren't actually trans. Now, here's what I sometimes see in practice in terms of rushing into things. Someone comes out as trans, and you probably felt it. You may be feeling it right now if you just came out as trans. And that individual may immediately feel enormous pressure, both internal pressure and external pressure, to do everything right now. Start hormones, get surgery, change all the documents, come out to everyone, go full-time immediately. And sometimes this urgency comes from the sense that, oh my God, I already wasted so much time, which I see constantly with older adults. The sense of urgency also comes from fear that if you don't move fast enough, access will be taken away. This is what we see right now in terms of what's happening politically, at least in the United States. It also comes from community pressures, from specifically, sadly, trans community itself. Pressures such as you got to be all in to prove you're really trans. And if you're not all in, meaning doing all of the things, you're not really trans. The pressure also comes from belief that medical transition is the only valid form of transition. Absolutely not true. And it comes from not knowing that there are multiple pathways and timelines. A lot of people I work with assume that there is this kind of trajectory, right? An order of things that they have to follow. The reality is that that is not true. The trajectory is what you decide is necessary and important for you, not for somebody else. So let me give you some examples of what I mean by rushing. Starting hormones without fully understanding the effects, timeline, or permanent changes. I see this a lot. Where somebody had an impression because of today's social media that starting hormones are suddenly going to give them all of these changes quickly, and they're going to be able to socially go out there and feel confident and good about themselves, only to realize that hormones, in the very least how their body metabolizes it, is taking way longer than they anticipated. Or pursuing surgery before having time to adjust to hormones and see how you feel in your body. I would say 80% of my private practice is working with trans women. That is my bulk of work. It's my passion. I love working with my ladies. And what I see a lot, especially with trans women, is this, like, and I get it, I totally get it, this external need to align everything to whatever is standard of a woman is out there now. And a lot of times what I see is lack of sitting back and reflecting, who am I? How do I feel in my body? What really feels comfortable for me? Do I really need all of those things? I see this all of the time. Other example of rushing in is making irreversible decisions while in acute mental health crisis. If you're struggling with acute mental health crisis, making huge irreversible decisions should be the last thing on the list. Transitioning to escape trauma or other life problems rather than because of gender identity. And this is where, if you are not sure if your gender dysphoria stems from the root issue of gender identity incongruency, if you have history of severe trauma, if you have history of other type of dual diagnosis, and you are wondering and you're not even sure and you're thinking maybe something else causes symptoms similar to gender dysphoria, this is where an evaluation with a professional is going to be invaluable to you. Another case of rushing is following someone else's timeline instead of your own. Again, going on social media, seeing everybody else doing things really quickly, and assuming that this is the way to go. By the way, I have a bulldog at my feet, my sister's time babysitting, snoring loudly. If Mike is picking it up, that's what it is. Another case of rushing is not exploring what you actually want versus what you think you're supposed to want. And this is crucial one. I hear this all the time, this idea of I'm supposed to want all of these things. I'm supposed to have all of the surgeries. I'm supposed to start hormones and I'm supposed to start this particular dose of hormones versus, but what do I actually need myself? I want you to notice that none of these examples of rushing are implying that you are not transgender. These are examples of you might benefit from slowing down and getting much more clearer on what you specifically need versus that means you're not trans. Okay, so I just want you to notice that because people can very quickly have knee-jerk reactions that, oh, so if I'm not going after surgery, I want, are you saying I'm not trans enough? No, no. If there's rushing an element for any of the reasons I just mentioned, I think it will be worth your while to evaluate them for yourself, whether they are right steps for you, not whether it means you're trans or not. Many of you are probably accessing care through informed consent clinics, which is amazing. The informed consent model says, it's so great. It pretty much says you're an adult, you're competent, you understand the risks and benefits, here's your prescription. Informed consent clinics are primarily going to be for hormones. And I am a big supporter of informed consent. I have them listed on my website as a resource. I love informed consent model because for older adults I work with, it removes unnecessary gatekeeping. It respects their own autonomy, and it gets a lot of my clients access to care they need faster. But, and I always talk about it too, here's what informed consent is not. Informed consent doesn't mean you skip the informed part. It doesn't mean you just sign the form without understanding what you're consenting to. And it doesn't mean faster is always better. The best informed consent providers will make sure you understand what hormones will and won't do. They will at least provide you with a brochure. They'll discuss timeline and permanence of various effects. They'll most important, screen for contraindications and risk factors. They check you're making this decision autonomously and not under coercion or under mental health crisis. And they offer ongoing support, not just a prescription. And if you are about to step in the informed consent model, here are some red flags that suggest a provider might not be practicing good informed consent. They're prescribing hormones at the first appointment without any conversation about goals, risks, or readiness. They just give you a prescription. That's a red flag. They're medical providers. They need to tell you about all of the things so that you make informed decisions. They don't ask you about your mental health history or current stressors. They push you towards surgeries or interventions you haven't asked about. They seem annoyed or dismissive when you ask questions. They suggest you need to do things in a very specific order or timeline, and they don't offer ongoing monitoring or follow-up care. These are all red flags. Good informed consent should feel empowering, not rushed. You should leave the clinic feeling more clear, not less clear. Make sense? So make sure you feel much more clear, like you just got information from a valid source, versus they gave me a prescription, but I have no idea how long the hormonal changes are going to take. So for now, how do you find the balance? For those of you watching, how do you find the balance to move forward with appropriate urgency to deal with gender dysphoria without also rushing into decisions you're not ready for? Here's my clinical framework. I'm going to give you about 5 to 6 bullet points. And then I'm also going to address most common things in the end. So stay toward the end. Like I said, this is a loaded video with lots of good, juicy information. So I'm going to give you my personal clinical framework based on years of working with trans adult clients. Take what's useful and leave what doesn't resonate, okay? These videos are for adults. I work with adults. Videos are educational in nature, so exercise your sense of discernment. Number one, how do you find a balance? Number one, distinguish between dysphoria and urgency. Dysphoria is real, and for many, it is very, very painful. But dysphoria doesn't automatically mean you need to do everything immediately. You can acknowledge this is really hard, while also taking time to figure out what will actually help me. Ask yourself in this scenario, am I moving quickly because I'm clear about what I need, or because I'm desperate for the pain to stop? Both are valid feelings, very valid feelings, but they might lead to different decision-making processes. Second tip, break it down into components. Transition isn't one decision. It never is. It is a dozen of separate decisions. Break it down into, for example, little buckets. Social transition. What's under social transition that's important for you? Name, pronouns, presentation, hormones, type of dose, timeline, goals, surgical interventions, which ones, in what order, legal changes, documents, records, coming out, to whom, when, how. Remember, you don't have to do all of this at once. You don't have to do all of them at all. You can start with the things that feel most urgent and sit with the others. For example, I'm going to give you a good example here. I'd be surprised if Mike doesn't pick it up because he's snoring loudly. Let me know in the comments. A trans woman might start with social transition first. See how that feels for her. Then hormones after some time living in her gender. Or she might start with hormones first, get a sense of clarity, confidence, assertiveness, then move into social transition. Then move into FFS surgery when she's ready. A couple of years later, or 6 months or 12 months later, bottom surgery, or maybe never. Maybe she's going to decide she doesn't have any genital dysphoria, she doesn't want to get a bottom surgery. Or she might do any of the steps in a completely different order. This is where creating little buckets with different aspects, elements of transition, and then organizing them in priority of what feels more urgent is going to help you make the right decision. Third tip, check in with your why. Before any significant decision, I really, really encourage my clients to get really clear on their motivations. For example, I want top surgery because I wanted a flat chest for as long as I can remember, and I'm ready for this step. Sounds like a solid why, check mark. On the other hand, if you're thinking I want top surgery because everyone in my friend group has had it, and I feel like I'm not trans enough without it, consider more reflection. Another example, I want hormones because I'm excited about changes and feel ready to navigate the effects. Checkmark. Solid why. Versus, I want hormones because I think I will fix my relationship and in the end will feel loved by my partner. Need more evaluation, more examination. I want you to notice on each one of this example, I am not saying the second examples where you need more reflection does not mean you should not transition, nor does it mean you're not transgender. I'm saying you might benefit from some therapy or personal reflection to separate what's about gender and what's about other stuff. What's about what you need and want, and what's about external pressure to do things because you feel it's going to somehow fix your life. Tip number 4, create a decision-making timeline. Instead of, I need everything now, or I'll wait until I'm 100% certain, which by the way never may come, try instead, in the next 3 months, I'm going to start therapy with a gender-affirming therapist. Then I'm going to change my name socially with close friends. And I'm going to research hormone options and effects. In the next 6 months, I'll reassess and decide if I want to start hormones, if I want to come out wildly. And I'm going to start consulting about surgical options. In a year, maybe, I'll check in about whether I want to pursue surgery, if I want to change my name legally, if I want to medically transition at all. This gives you structure without rigidity, and you can also adjust it as you go. Tip number 5, notice what brings relief versus what brings anxiety. Let me repeat, this is important. Notice what brings relief versus what brings anxiety. When you think about specific intervention, does it bring a sense of, yes, finally, this is right? Or does it bring anxiety, pressure, and I guess I should, maybe I should? That's a very, very distinctive difference. The first one suggests readiness. The second suggests you might need more time or more clarity. Now that I gave you 5 tips on how to find the balance, let me now address some very common concerns I hear from clients that I tend to work with. The biggest one, what if I regret it? Here's the truth. You might. That's right. Yeah, you might regret it. Not because you are not trans, at least not in my experience. Again, I work with trans adults. Majority of my clients are 30 and above. So it's not because they regret it because they realize they're not trans. No, but because you might choose a specific intervention that doesn't end up working for you. But guess what? That's a risk with any medical decision. Think about other medical decisions. Think about anything else that people tend to get, and then they, decide that, what? Maybe that's not exactly how I want it. Like I said, I have a lot of trans femme clients who got breast implants and then removed breast implants. Not because they're not trans women, but because they realized that they actually did not want breast implants. It didn't really make sense with their relationship to their feminine body and their aesthetic. Here's what I tell my clients in the situation of will I regret it? Regret from taking informed action is very different from regret from not acting at all. Most people can live with, I tried this and it wasn't right for me, better than, I never tried and always wondered. Do you hear the difference? Most people can live with difference. I tried and it wasn't right for me. Way better than they can live with, I never tried and I always wondered. Another common one that I want to address is when people tell me my doctor or therapist wants me to wait, but I feel ready. Now, this is where it gets a little bit tricky because sometimes providers, I'm going to speak for mental health providers because that's my field. Mental health providers are being appropriately cautious. Sometimes they're definitely gatekeeping for sure. In this case, to tell the difference, ask yourself, is my provider asking me to wait while we explore something specific and relevant? Or are they applying arbitrary waiting periods because of their own discomfort? It's the latter. It might be time to find a new provider. Again, if you feel ready, but your provider makes you wait and you ask them, what is your rationale? And they can give you a very good, solid reasoning based on working with you and knowing your psychology, and it makes sense, then they have your best interest. If they're just saying that, well, according to guidelines, I gotta wait 6 months, or I just think you need more time, or, answers that don't lead anywhere, and they're just doing it because they're uncomfortable by making a call or providing you with evaluation letter, seek another provider. Here's another one that I get also. People ask me, how do I know if I am ready for transition steps? Well, the truth is you probably never feel 100% ready. But you might feel, and this is important, so pay attention, but you might feel clear about what you want and why, informed about risks and benefits, supported by people who care about you, grounded in your identity, and prepared for the realities of the intervention. That's usually ready enough, in my experience. Meeting all of those is ready enough. But 100%, there's supposed to be a tendency to hesitate, especially hormones and surgeries are a big deal. They are a big deal, a really big deal. So some level of I'm not really fully feel 100% is going to be there. Now, what I want to cover right now, another really important step, and I want to talk about the role of therapy in all of this, because it's complicated and often very misunderstood. First, you don't need therapy to be trans. You don't need therapy to be trans. You don't need a therapist's permission to transition. Your gender identity is valid whether or not a mental health professional has signed off on it. Very, very important. A gender specialist, such as myself, what can do is help you clarify where you are on gender spectrum, help you get clarity if the dysphoria you're experiencing stems from actually gender identity root issue and not some other underlying causes, can help you figure out what your personal timeline is, can help reevaluate your psychological tendencies, temperament, character, and based on that, help you create steps that are going to work for you and not against you. That becomes very handy. So here's what a good gender affirming therapy can offer. Like I already said, it can help you explore what you want versus what you think you should want. Support in navigating family, work, social transitions. It can help you with tools for managing dysphoria while you're in a process. It can create space to process grief, excitement, fear, and every other emotion you're going to feel in between. It can help distinguish between gender stuff and mental health stuff, support for any co-occurring issues, trauma, depression, anxiety, and it can create a neutral space to think out loud without any judgment. That's what therapy can, but again, it is not mandatory, so keep that in mind. Good therapy doesn't slow you down. It helps you move forward with clarity. That's what when I work with clients, I'm not about rushing or slowing you down. I'm about for you to walk away from a session with me where you have so much clarity and understanding why I recommended certain things, that you feel confident, you feel informed, you feel comfortable. That's what a good gender therapist should do. Now, I want you to remember, you're always allowed to change your mind, adjust your timeline, go slower, go faster than you planned, and make decisions that other people don't understand. Now, if you struggle right now with transition related fears and you want to transition, but fears are holding you back, I link below a workshop I created to help you overcome them. And if you are interested, check out the link below. So to wrap up, let's come back to the original question. How do we balance early intervention with thoughtful decision making? Here's what I personally learned through years of clinical practice working with trans clients. We can actually hold both truths. Trans people deserve immediate access to affirming care, and individuals benefit from making informed, autonomous decisions at their own pace. Both of them are not contradictory, right? The goal isn't to slow everyone down, but it's to remove external barriers while supporting internal clarity. Some people will know immediately what they need, and they will know immediately how quickly they need to move. That's very valid. Some of you will take years to figure out your path. That is also valid. Some will try things, they will adjust, try other things, and find their way through experimentation. That's also valid. The question isn't, am I moving too fast or too slow? The question should be, am I making decisions that feel aligned with who I am and what I need? Let me say it again. The question should be, am I making decisions that feel aligned with who I am and what I need? My clients know themselves better than I ever could. That's for sure. And you know yourself better than anyone else does. So trust that. And also trust that you're allowed to take your own time figuring out what that means for your life. You don't ever have to all figure out. You don't have to do everything at once. You don't have to follow anyone else's timeline. You just have to take the next right step that is right for you. Now, if this was helpful, please like and subscribe. Drop your thoughts in the comments. I read all of them, and your experiences help other people who are navigating this too. So make sure you share your experiences below Resources are in the description box below. And as always, if you're struggling, please reach out to trans affirming therapist or support line. Take care of yourselves. You've got this. And I will see you all in the next video. Goodbye.